all Buettner's family. Great supportive community, close-knit caring family. We're non-judgy, blanket fuzzy, stigma-free. All Buettner's family, friends, family, and community. We all Buettner's family. Teacher sharing is our key. Great big thanks to you all.
Hello, and welcome back to another episode of Stigma Stompers. I am one of your hosts, Abby.
And I'm your other host, Janana.
Today, we are talking all things crisis services. We have a guest with us today, Stacey Buettner. And I'm just going to let you introduce yourself, and we're going to get right into it.
Great. So thank you for having me. I'm glad to be here. So as you mentioned, I'm Stacey Buettner. I'm a licensed clinical social worker. I work at UPMC Western Behavioral Health at Safe Harbor. I've actually been there for about 17 years now and counting, and currently in the role of program director for our Crisis Services Center here in Erie.
Perfect. That's amazing. Thank you. Thank you for joining us today. I know you guys do a lot, so we're happy to have you here and find some time to share with our audience about your services. So what does Crisis Services do, and who do they serve?
Great. So we are a 24-hour crisis center. So we do answer phones. So we could provide phone support if somebody wants to call in anytime, day or night. We do answer through a local number, which I'll provide. And we also do answer calls for the 988, which is the National Suicide Hotline. We do also offer walk-in services, so people can come to our building and meet with somebody face-to-face. We also offer mobile services, so we can go anywhere in Erie County to meet with somebody to just better support them, understand what they might be experiencing, and then typically we will work with that individual to make some recommendations for referrals or services that we think might be helpful. And so we can also assist with getting people connected to those services. We have some follow-up processes, not only continuing to check in with people over time, but also if sometimes it's just there are barriers. There are reasons why people might struggle to get connected to the services that we're recommending. And so we do also have individuals who can help, maybe take a person to an appointment or to just really get that ball rolling so they can get the help that they need.
Awesome. Thank you. I do have a follow-up question. So you mentioned you guys work with 988. I know there's a lot of confusion on how that system actually works, where since it's a national line that people can call into or text to, how do you guys get to that step in being in that process?
Yes, we've actually been a part of 988 for over a decade at this point as well. And so I think there's also been some misunderstanding with 988 being new. It's not new. It's been rebranded, so to speak. So in July of 22, it's now referred to as 988 instead of, Lifeline, as we historically have referred to it. So there are, across the state of Pennsylvania, there are 14 call centers who are on the Lifeline network. Basically, we have geo-routing that's in place now. So if somebody were to call into 988, they would actually get routed to the call center that's closest to them in geographical location. So for Erie, we do answer the calls for somebody who is located here in Erie. So if they dial 988, they are getting our staff here in Erie County. And then ultimately, the support doesn't change. So whether you're calling nationally or if you're talking to somebody locally, we want to be there to support people. You could call in anonymously. That is one of the biggest changes or differences that we notice between people who are calling in locally versus 988. We get a lot of anonymous callers through 988. And so, again, we support that, and we just want people to be able to feel comfortable calling in should they need somebody to talk to. And then if somebody who's calling in is in need of, being seen face to face, we can, again, work through our crisis process and just offer those services and help to meet them where they're at.
Awesome. Thank you.
Mm-hmm. And people can text 988 too, right?
Yes. So they can text and chat for 988. We do not answer those at this time. Mm-hmm. So that's something we hope to be doing in the future. But again, also, so for people who may not want to pick up a phone and talk to somebody, just knowing that somebody is accessible in a lot of different ways to them.
Mm-hmm.
There's also different lines. So they have like a Spanish network line, a line specific to if individuals from the LGBTQ plus community want to call in. There's a hearing impaired line. So there's a lot of also specific lines, veterans line, just to help people feel more comfortable that they're really talking to somebody who has that additional training and support to deal with things that they might be dealing with.
Yeah,
That's great.
awesome. Thank you for sharing that.
What would you say are some of the most common reasons that people reach out to crisis services?
There's a wide variety. So we have people who might just call in to talk. We have some people who call in pretty regularly, and we're here for support. But really, we try to just say, like, we don't define the crisis. So again, what might result in me calling versus somebody else, could just be very different things. But we see where people might call in for themselves, just needing some support. Other people might be calling in for a loved one. They're maybe noticing some things or they're concerned about them. We also have strangers who might call in because they're just, observing some things and they have some concerns. So, in addition to, having somebody to talk to, but, sometimes people are just looking for referrals. What types of services or resources are out there? What might be helpful for somebody who's, dealing with, any variety of things. And, I always say that if you're questioning, should I call crisis? I think that's often people are, maybe hesitant to call because, they don't know if this is a crisis. They don't want to feel like a bother to anybody. If you're contemplating or, should I call? Or yes, definitely call. And again, we can help to support and walk somebody through that.
Right. It's better to call and, even if it's not an emergency, better to call than regret it later.
Yeah.
I do have another question for you. So when it comes to someone calling in, let's say I know someone and I call in for a different individual, what does the process look like? What can I expect? What are the next steps and things like that?
So when somebody is calling in, we typically like to reach out to somebody by phone first. So, if you're calling in, you have concerns about somebody, we'll gather some information, try to better understand what might be happening, with that person. We want to try to reach out and offer our services to somebody. So just as much as I don't know about you guys, but I don't love somebody to just come and unexpectedly knock on my front door. So we do typically try to, call and outreach by phone first. There are circumstances where maybe going to the house might make more sense, or going to the location where that person is and meeting with them in person first, or offering our services in person might make more sense. So, really that's our premise, is we want to offer our services to somebody, see how we could be helpful. So really it's about how do we engage, so that they could be receptive to work with us. At that point, again, when we meet with somebody, we're really just talking through what's going on, trying to identify if there are things that they can identify that would be helpful or that they need. We might make some recommendations and work with them on that as well. So really trying to make that a collaborative process. And then, as I said, trying to just follow up with that person, make sure that they are getting connected. And, we could do that over a period of time as well.
Yeah. And me as a loved one, if I make that phone call, do I get any, updates on what has happened, if you reached out to the person, or do I get any updates about the phone call?
You do. So we try to maintain confidentiality, so we want people to feel confident that we're not sharing, all the specifics of our encounters with somebody. But for the person who's calling in with concerns, we also want to make sure that they feel that they're in the loop, that they're aware of maybe what has transpired. So we will give some basic information about whether, we've been able to connect with a person, if they're, receptive to services. Again, just enough to kind of satisfy that concern, right? Because we're thankful that that person is called in. They had concerns for somebody. So we want to make sure that they can feel satisfied knowing that that person is being taken care of. And then, and there are times where people may not want services or help. And so we also give that feedback as well, and can talk about next steps and what that might look like. But we want to make sure that we're collaborating and really working with the people who are calling in with those concerns.
Thank you.
That's great. As far as, so if someone's at a point where they're thinking that they might want to call crisis, what are some key signs that maybe that person is experiencing a mental health crisis and a call to crisis would make sense?
So I think that, so this ultimately might depend on that relationship, right? So as I mentioned, sometimes we have strangers or people, I myself have been in the community and experienced things that I'm like calling crisis. Thankfully knew who to call, given my role. But, so that can happen. So anything, I think the first thing is like we have intuition for a reason. And so if something is telling you something is like not right or you're concerned, again, call, because we can try to, work through and talk through with that person, what that could look like. So depending on the relationship. So for people that we know well, I think we would be able to pick up on some clues that somebody might not be doing well, maybe in a better position to do that. Somebody that we see often rather than somebody that we're maybe more of acquaintances with. So some of the things that I would just say is like change, right? So anytime that we're noticing a change, so a person who change of appetite, change of sleep, hygiene, how they're presenting. There are times where somebody who's just not feeling well is just not able to take care of themselves in the same way. When we notice changes in mood, some irritability, I think when somebody is having a difficult time, it's not always wrapped in this like pretty package, right? Of somebody saying like, hey, I really need some additional support. I mean, really, they can become irritable. They can become kind of agitated or maybe isolating, right? So they're withdrawing. So the person who you're, inviting to come out and do things with, and now they're avoiding you, or like they keep declining the invites. And so I think sometimes, I don't know about you, but sometimes I've like been frustrated, right, with friends or, so we can sometimes look at that as like, an unpleasant, but those are also the very same things that can help us to know that a person might be struggling. Some of the other things, I mean, if we know that a person is having thoughts of harming themselves, so self-harm, if they're having thoughts of suicide, if they are becoming aggressive or making statements of wanting to hurt others, those are all things too that we want to be on the lookout for. I think one of the themes that we see for people who are really struggling, or especially who are having thoughts of suicide, is like a deep sense of feeling alone, having loss that they've experienced. And so those are some things that might be helpful to look out for somebody if you're concerned that they might be, might be struggling.
Yeah, absolutely. So if a bystander or a loved one sees someone is in a crisis, what are things that they should avoid doing in that situation?
Yeah. Well, I think one of the things to do is to try to engage, right? I think, again, we're using our intuition. So if there's a situation that really feels dangerous, scary, uncomfortable, we want to make sure that we're taking notice of that. And that might depend on that relationship too. But somebody that I know close who might be struggling, we want to allow them some space to like talk about what's going on. So I think being able to make sure that we're willing to ask, how they're doing, asking the uncomfortable questions about suicide. Are you thinking about suicide? Which is hard for people to ask and to ask directly. But we want to make sure that when we're identifying that somebody might be actively in crisis, that, we're on the same page. So I think that, one of the things that, we do a lot of different training. So I do like a applied suicide intervention skills training. And one part of that is that we always ask our participants, like, if you were having thoughts of suicide, right? Or you could generalize that. If you're having a crisis, who are the people that you're going to talk to about it? It's always friends and family. And so as a mental health provider, right, I'm like very humbled by the fact that we are not the first person or the preferred person for somebody to talk to about, what they're going through. And so I think that's just, for me, communicates very like openly that we need to be there to support our friends and family in the best way. And so just being able to listen, to support them in that way. Some of the other like tangible things. So I think watching our tone, right? So I think when we are approaching a situation or talking with somebody who's like is having a tough time, just remaining calm, which can be hard, right? We might be shaking on the inside because we're like fearful for them, or again, if somebody's talking about suicide, that could be very scary and frightening for us too. But remaining calm. Some of the things you could do is like remove distractions, right? If we can get a person, if there's other people around that we can kind of disperse and get out of the way, or to give that person some privacy as well, that will also allow for us to be able to talk more with them. I think sometimes just, again, like being collaborative. So, is asking if there's a way that you can help. I think it seems simple, but, sometimes people will have hey, this is what they need, right? Or sometimes we have basic needs that somebody might have that aren't being met. Maybe we can get them, can I get you a glass of water? Can I get you something to eat? Sometimes those are things that really can help to de-escalate. It's very simple, right? So, those are things that we can do. But I think also helping somebody to just feel heard, help them to feel safe, allowing some time to talk out how they're feeling. Now, again, if a person's in a crisis can mean a lot of different things. So a person could, be in a place where they're able to engage and have that conversation with you. Other times where they might be agitated and really frustrated, then of course we want to give space. And so when you say what are some things to avoid, so we don't want to talk over a person and try to yell, to talk them down, right? To want to be heard in those circumstances. Really, it's about hearing them. But we also could give them the space that they need. I know that there are some people who are huggers. Right. And physical touch is something that they want to help to support people. But, we want to be mindful of that. And what does this person maybe need from me? Hey, is it okay if I give you a hug? That will allow us to know whether that person's on board for that or not. And if they are agitated, just giving really that space. We want to look at it's an arm's length times 3, right? So we want to really give some good space there for the person, not because, again, that we're afraid they're going to cause harm to us necessarily, but just again, when we're uncomfortable, that bubble that we have really can just become bigger. I love that this is all about stigma and how do we really address that. And so I think really being clear that the physical space is to just allow that person to feel safe, not because, again, what we know, people who are in crisis or who are experiencing mental health concerns really are less likely to cause harm to others, right? It's they might be more likely to cause harm to themselves, or actually are more vulnerable to being victims of violence by others. Mm-hmm. So again, don't want to portray that we're giving space because of that, but just allowing that person to feel that physical safety, as well as while we're talking to them, feeling supported.
Yeah, of course. I like that you bring up stigma. What have you seen in dealing with different clients and things like that there is a stigma, that people are hesitant to reach out for help because of the stigma still?
Absolutely. And so I think, again, is somebody defining even what they're in as a state of crisis, they don't want to be labeled all the things. Mm-hmm. And so I think, one of the things I encourage people to also be mindful of is language. So as we're talking about mental health concerns, as we're talking about suicide, we want to talk about it in a very informed way, non-stigmatizing. And so that's where, talking about suicide as, a person who's died by suicide, not by completed or successful, unsuccessful attempts. Again, we want to be very mindful of language, and that ultimately can help us to break through some of that barrier. We want people to feel open to be able to talk about it. When we talk about, and we look at NAMI statistics, right? So 20% of individuals, are experiencing mental health concerns in any given year. We know that most people at some point in their life have had thoughts of suicide. And so it's really a human experience. And so how do we help people to just understand that and, bring awareness of it's important to talk about, because when we keep it hidden, we don't reach out, it really, can just snowball and really has more power than that we don't have to give it.
Yeah, Absolutely. Thank you.
Oh, it's me now. So sometimes people are dealing with a situation with like a loved one or even a stranger where they just might be feeling down, but sometimes it can be a really heightened situation. So how would you recommend someone handle de-escalating a crisis situation before professional help can arrive?
Mm-hmm. Yeah, I think so. Some of the things that could be helpful, I mentioned like actively listening. I think sometimes what we do as loved ones, friends, any of the relationships is we're listening, but it's in a way to like respond. I think, please know that you don't have to say the perfect thing in these situations, but to let the person feel that they're being heard. Even just like letting a person vent. So even if a person is, kind of is frustrated, is upset, crying, whatever it might be, getting some of that out can really be helpful for the process and to de-escalate. Avoid challenging that person, even if some of the things that maybe they're saying you don't agree with or aren't necessarily, again, not something that you hold or believe. It's okay, right? So like this is like their experience. This is what how they're feeling. So we want them to really be able to get that out. But in times of let's say the crisis is being called and you're waiting for crisis to respond. Also gathering additional information can be helpful. Continuing to engage that person, ask questions, not rapid fire, right? But open-ended questions. Let that person talk. Hey, tell me more about this. So that you're really gaining a lot of valuable information that you can then pass off to your helpers or whoever else might be coming in to help support that person.
Yeah, awesome. So when should someone call crisis instead of 911? How do you differentiate who to call?
Yeah, I love that. So part of 911 really is if emergency responders are needed. If a person has already harmed themselves, harmed others, or are about to, right? We could determine that the situation's escalating. We would want to call 911 so that responders can arrive as well. Crisis can be a secondary, but again, we want to get immediate response there. 988, and that was the whole premise behind it rebranding, right? So we know that if somebody has a medical emergency or if there's a public safety concern that we call 911 and first responders will arrive. 988 was really designed, we want people to know the number. So it used to be 800 number, which is like hard to remember. Even though all the presentations I've done it at times, it's like you could fumble over that a bit. And we also don't want people to like have to be like Googling or researching it when they're in a time of crisis. So 988 really is the behavioral health emergencies in that sense. So when you're wanting to talk to somebody, if again you're looking for resources, referrals, we work very collaboratively with first responders. So should you call 911 and they respond and they notice, hey, actually crisis should be involved, they'll call us and then we'll respond to them as well. And there's other times that we are getting a call from a loved one and we determined that there's maybe some safety concerns here and we want to make sure that we go with law enforcement. We'll call them and ask them to go with us as well. So again, it's better to call, right, to get to, and even between the 911 call center, we do transfer calls back and forth depending on if somebody did, incidentally called the wrong number. We want them to be able to talk to somebody. But the diversion from 911, we don't want first responders to have to respond to all the calls because, law enforcement is always actually is not needed in a lot of situations. And so we want to make sure that we try to divert from that and only utilize those resources when we really determine that it's needed.
Yeah. Thank you.
Mm-hmm.
Kind of in the same breath, how does crisis services work with law enforcement, hospitals, or other mental health organizations or agencies?
Yeah, so, going off of like law enforcement, we actually do have, I talked a little bit about the co-response we have there. We actually do have 2 programs currently. We have a crisis worker who is stationed at the Mill Creek Police Department. So he's co-responding with officers whenever there's like a behavioral health component to the call that's coming in. And then we also have 2 clinicians who work exclusively with Erie Police Department. So, again, they are, the intention behind that is that they are working with Erie's crisis car unit. So there is a unit of officers that have had some additional training in behavioral health, and so they're co-responding with our crisis staff to situations to help de-escalate, make sure that they're working together as a team. So we work a lot with law enforcement in that capacity with offering services to people. We work with the hospitals a lot. Part of when we're working with somebody in crisis, we want to get them referred to the service that's going to best meet their needs, but also is like least restrictive. So we don't want people to have to go to the hospital if that's not really what they need. Maybe they need outpatient services or all the services that are in between. So we would work with them to try to get them to the right level of care. So there are times where, we actually would accompany somebody to the hospital if we're in agreement that this is really what would be most helpful for them at that time. Crisis is really there to help support that individual, advocate, kind of just, again, it could be a scary time for people. So just helping them to understand what to expect. And sometimes people just show up at the hospital and, again, maybe they've been there before and they found it helpful. And so they're looking for admission again. Other times that's like the place that people think to go, right? So sometimes they might show up at the hospital and the hospital's determining that they don't really require that level of care. So they'll call us as well. But we work closely with other providers, especially blended case managers, people who might, actively be working with individuals. So, natural supports. I mean, we really want to try to make sure that it's like a collaborative effort, so that, that person could feel most supported.
Yeah. And I'm glad you brought up the Mill Creek Police Department. We actually, I think they might have met the crisis representative at
I think they did.
Mill Creek Police Department. We did a mental health first aid training for all of the Mill Creek Police Department, all of their staff. And I'm pretty sure someone did mention that they met the individual who works on the crisis side of things.
Yeah.
So is there any resources out there for families or caregivers who want to learn how to respond to a crisis?
Yeah, I think with we have a lot of trainings. I think can be one area if people want to get some of the tools. I think not only learning the skills, there are a lot of trainings that really help to get hands-on and practice the skills. Mental health first aid, which I know NAMI has offers that. We have several through different grants. We've been offered question, persuade, refer, which is like a gatekeeper training to ask about suicide, get somebody, support them, and get them connected to other resources. Assist, I mentioned that, applied suicide intervention skills training. So that's a bit more involved. That's like a 2-day, but you're really getting into practicing the skills that you're learning. But there's a lot of virtual too. So I love in-person trainings personally, but there's a lot of opportunities even virtually to attend. We have counseling on access to lethal means. There's suicide prevention and links to substance use disorder care, integrating trauma-informed care so there's a lot heavy around the suicide response. But I would also say supports, so again, crisis can walk through what somebody's particular situation is and make recommendations for what might be most helpful, but also support groups, being able to talk with others who have a loved one who's dealing with mental health concerns can really be helpful for people themselves, getting connected to another peer, somebody who has a lived experience as well, just helping people to know that they're not alone and their experience can be really powerful.
Yeah, absolutely. We actually offer peer support and family support groups. Yeah. And to your point, I've attended a few, especially when I first started working here, and truly is amazing. I mean, they support one another. They sometimes someone might think of something that another individual hadn't. So it's like bouncing ideas off of each other, but also just having a safe space where you know these individuals are going through something similar that you are. So our family support group is every Thursday at 6 p.m. And then our peer support group is every Wednesday at 6 p.m. And those are located in our office, which is 1611 Peach Street. Or there is a virtual component to that as well if you aren't able to make it.
I think I obviously have to plug other programs as well.
Yeah.
With Family to Family, which is kind of like family support group, but it teaches you how to help your loved one in a crisis situation. And then Mental Health First Aid does the same thing too, and we offer them free. So
Yeah.
I had to plug them.
I know, I feel the same way, right? Well, and I think that, I think we're doing a lot of really good work in Erie, and so being able to offer that to people just, because again, I don't think people always know that this is usually when somebody's going through a first episode or a first experience, crisis, they feel alone. And so helping them as well as their supports, their family, to know that there are other people that can help them through it.
Yeah, absolutely.
Definitely instills hope. So
Yeah, for sure. In Erie County in the past year or two, have you seen a decrease or an increase in crisis service calls, crisis dispatch, mental health inpatient stays, etc.? And why do you think that is?
So we are seeing an increase. So there has definitely been challenges with our system, with the volume of individuals who are reaching out since COVID. We saw a huge impact, and the challenges with being able to meet the needs. We are definitely in a place, I think, as a community where we are seeing individuals so maybe not only volume is picking up, but also like the acuity of their symptoms, that people who are really symptomatic, really struggling. And so experiencing some challenges and getting them connected with services that are needed. But the thing that I just say is, even from Crisis, I mean, I stand with a amazing team who are great problem solvers and really compassionate individuals, and really just trying to make sure that they're doing the best they can for somebody and helping them to get into, gain access to the treatment that's needed. But when we experience those challenges, the one thing that I can just say is I appreciate that our community really comes together. We will team different opportunities or talk through, what are the things that are needed? Are there gaps? How do we overcome that? So I also am seeing a lot of that as well, which again I'm grateful for.
Yeah. I feel like our numbers have increased as well. And I feel like it's a combination of still aftermath of COVID, but also I think people just know about the services more. So they probably have been struggling with this, even before COVID, but they just didn't know who to talk to till now. So I feel like every service, every mental health, behavioral health service in Erie has been working so hard to make sure that people know who to call. I think it's paying off. So I think that also contributes to why we're seeing more people.
Yeah, and I'm still amazed at how many people still don't know that Crisis exists, or and again we feel like we're doing so much around awareness, and we actually have some 988 campaigns that will be taking place over these next few months with Spotify and other social media. And so again, we want to bring the awareness and help people understand that the resources are there. But I'm always surprised when I'm like, wow, so many people still have yet to learn. So yes, I'm hopeful that we'll continue to see that growth, because we know that means people are reaching out when they need it.
Yeah. It's not great that they're struggling, but it's really great that they're asking for help. So.
Yeah, and I think the more proactive, right? So it's hey, I'm not feeling well. How do I really just reach out and address that quicker, right? More proactive than waiting for it to really develop into something more challenging to then address.
Yeah, absolutely. Does Crisis Services have any plans on expansion just because you guys are seeing these increases in calls and increases in demand, unfortunately, but is there any plans for expansion or how to accommodate those increases?
Well, I think we're always keeping an eye on that, and so we have some ideas in the works and things that we might be able to work through to improve response time, especially to more rural areas. But I think even through like our co-response, that's where we're seeing that as well. We've actually been able to then essentially add 3 more individuals in our community to our complement that we already have. But yes, we are very, very innovative thinking. We also have, we are a part of the UPMC umbrella as well. So we have a service line through Crisis Services. And so even just the tapping into and better understanding what crisis looks like in other cities across the state has also been really helpful. So we are growing even our administrative team as to have some more ideas of how to expand, how to better meet the needs, how to improve, streamline, all of that. So yeah, always
Cool.
thinking about growth. Yep.
Yeah,
Cool.
That's amazing because I know it can be tricky when there's that increase of individuals asking for help, which is a good thing that they're asking for help, like Abby said. But I know it can be tricky for staff, if you haven't had that many calls coming in before. So thank you for sharing that. I appreciate it.
Kind of starting to wrap up. What advice would you give to someone who's worried about a loved one's mental health?
I think, again, being able to share that with them, if you feel comfortable being able to do that, I think having the conversation with somebody, hearing what's going on, we talked about earlier that we can address something the better. So being cognizant of what things to look for, when something feels off, ask, I think, especially in the realm of like asking about suicide. I under no impression that that's like the easiest like conversation to have with somebody. But when we're hearing those themes, we're hearing that a person is feeling alone, when we're hearing that they've experienced a loss, kind of that like darkness that they could be experiencing, we want to ask the question, we want to know. And so being able to ask, and I've had to ask people I love and care about too, if they are having thoughts of suicide. And that's like the hardest question I've ever had. And I talk about suicide all day, every day. So I think, again, it's not lost on me that it's like a difficult decision. But be willing to ask, hear what they're going through, and to just be with them. I think there's so much power in we. Like, is it okay if like we go and talk to somebody? It might be helpful for us to have somebody to talk to about this. Can really help that person to feel supported in a really difficult time for them.
I know there's a common misconception, which is something that we talk about in our mental health first aid. A lot of times people think if I ask that question of, is someone thinking about suicide, I'm going to put that in their head. Do you have any advice for those individuals who might be thinking like that?
Yeah, thank you. One of the greatest myths in suicide intervention. So, just helping people to understand that that's like not the case. If you're asking a person directly, and we do want to ask directly because we want to make sure that we're not talking about self-harm or talking about suicide. They are different things. But if we, are asking somebody directly if they're having thoughts of suicide and they say yes, it's because they are. It's because we asked. It's because they are experiencing that. It's not because, we planted the seed, so to speak. I always love to, so when we do our trainings, I always love to give an example. Like if I were to ask, if I were to ask you two now, if you would like a pet tarantula. I'm hoping you're saying no, right?
No, I'm good.
In my house,
Absolutely.
heck no, right? And my son was liking some reptiles. I'm like, no. But just because I asked does not mean now after we're done talking that you're going to rush to the store and go buy a tarantula. So again, you either wanted one before I asked or you didn't. And so the same applies when we talk about suicide. Is you can't plant that seed. Now people can sometimes. That can connect some dots for them of like, oh, yeah, this is what I'm thinking about. But again, it's like putting a name to the experience. It's not that they're now thinking about it because you asked. So I think just helping people understand that. So, all the more reason why we want to get involved and ask the question. But yeah, I appreciate you asking that. There's a lot of myths associated with suicide. And so people can call me. We'll talk. We'll talk it out.
I think we've learned that when people take mental health first aid and they learn that nugget of information, a lot of times that's like the most interesting part of the whole training to them, because I think every single person that takes it thinks that is going to happen, and it's just not the case. So.
Yeah, and that was a wonderful example you gave. That was perfect.
Yeah.
Because I definitely would not want a pet tarantula.
Or snake or any of the things, but yeah.
Fluffy with 4 legs.
Exactly. All right. So how can people prepare in advance in case they or a loved one are experiencing a crisis in the future?
So I think, just knowing resources too, I, again, share that, for crisis services, you don't, in a state of crisis, like when you're frantic or you're upset because your loved one is having a difficult time or going through something big, you don't want to have to be just then looking for the phone number or, so I always tell people like program it in your phone ahead of time, 814-456-2014. So you have that handy. So knowing resources, talking with, family doctors. So again, even if most people at least initiate some mental health treatment through PCPs. And so being able to talk early on with the family doctor in those ways as well. But I think, also just develop some, so for a person who there might be safety concerns, whether that's self-harm or thoughts of suicide or other things, we want to establish safety plans, right? We want to really work through with the person, what helps them, what can they find triggering, right? What can add to or fuel when they're in a state of crisis, but also what are the things that like help you immediately? What are the things that help you to stay well? And so I just love that. I mean, looking at it through the lens of like wellness, how can we help you to stay well? Which is something like we all should be doing, right? Yeah. What are the things I need to do day to day to also help me feeling good, So I think just working with your loved ones, really having those conversations and being available. I think sometimes in life we're like super busy, and so we're going from one thing to another, and so just being able to give that person time, can be really helpful.
Yeah, absolutely.
And finally, our last question for you: where can listeners find more information or connect with crisis services for help?
Yeah, so we do have a website, so UPMC.com. If you click on the behavioral health services, you'll see crisis services there. So it also will share a little bit more about the other things that we do, which I forgot to mention conveniently. But great. We talked a lot about what we do, like in the immediate like crisis or how to address crisis situations. We also do trauma response, which is again something that we don't ever want to have to think about, but if somebody is experiencing a death, a tragedy, we actually can send staff to go and provide support to that person. We also, on a larger scale, do that, what is referred to as critical incident stress management. So really it's designed around how do we support first responders who are responding to traumatic things every day, throughout their workday. And so how do we help to provide support to them so that they can continue to do that meaningful and very much needed work? And then, just we also do a lot of like community awareness. So there's lots of, so I love summer's coming, and you feel it because you're getting a lot of requests of doing health fairs. And I know NAMI has some great, like looking forward to like Guns and Hoses and other movie nights and other things over the summer. But so we do a lot of like awareness and sharing with resources with people there. So don't be afraid, like just come up and say hello, grab the free items, but learn about about the services. And then, as I mentioned, we do a lot of like presentations, trainings. We really want people to have the information. Anytime that we're talking about addressing crisis or a suicide prevention, it's not just my business because of working in mental health or working at Crisis. It's everybody's business. And so I think just making sure that people have those resources, the tools that they need for that. So all of that is on our website, but also you could call in. So calling Crisis directly. So I know we talked a lot about like Crisis. Our local number is again 814-456-2014, and so there is a lot of benefit to also calling locally. Not that people can't call 988. However you get to us is fine. But what we tend to see is calling that like local number. We have sometimes we have information, right? We might have seen people before, or we have a history, or we've supported them before. And so that can also be meaningful and helpful information down the line. Plus we're familiar with like the geography of Erie County, the resources. So again, I do encourage people to continue to call locally as able, but also 988, as we talked about. I mean, three numbers, easy to remember. You could call, you could text, you could chat. So again, just knowing that there are resources out there for people to support whatever the need might be.
Wonderful. Thank you so much, Stacey. We really appreciate all your knowledge and sharing your expertise. And thank you for being here with us today. We hope everyone listening today that you learned something new, and that you can call Crisis if you need to.
Thank you.
Thank you.
Yeah, thank you.
Thanks for joining us on this episode of Stigma Stompers Podcast. We truly appreciate all your support.
If you want to see more about what we do in our community, make sure you check out our website. It's namierie.org. Make sure you also click on our t-shirt store tab so you can buy a t-shirt. We get a portion of all the proceeds. And make sure you sign up for our newsletter. It has all of our programming and event updates.
Another way you can get involved is if you feel comfortable sharing your personal story. You can email us at info@namierie.org, or you can give us a call at 814-456-1773.
Thank you for tuning in, and we'll see you next time. Bye!